Hello everyone, I am Dr. Anubha Pandey, Consultant Radiologist and Director at Race Diagno Interventions Private Limited in Varanasi. Today I am going to share a presentation on a very confusing topic, that is bone infarct versus enchondroma. The pathogenesis of bone infarct and enchondroma is very different. Bone infarct results from reduced or complete absence of the blood flow to the bone, and enchondroma is a benign cartilaginous tumor. On a plain radiograph, it's very difficult to differentiate between these two entities because both of them are intramedullary and both has a sclerotic margin and a similar pattern of the calcification. So it's very difficult to differentiate whether it is an enchondroma or bone infarct. So the next imaging modality which will help us in differentiating between these two is MRI. On T1 weighted images, enchondroma shows thick sclerotic peripheral margin and the center of the lesion shows low to intermediate signal chondroid matrix. Whereas the medullary bone infarct, the center of the medullary bone infarct has a similar signal intensity as in the normal bone marrow, and the periphery of the lesion has sclerotic thin hypointense line. On T2 weighted images, it's very easy to differentiate whether it is enchondroma or bone infarct, because enchondroma has a thick sclerotic peripheral margin. They are very well defined lesion, and the center of the lesion shows hyperintense signal because it is made up of the chondroid materials matrix, which is very rich in the water content, so it appears hyperintense on T2 weighted images with a tiny ring and arc like foci, which are very characteristic of the chondroid matrix. Bone infarcts on T2 weighted images, the center of the bone infarct has similar signal intensity as the normal bone marrow on all sequences on T2 weighted and T2 fat set. This is the T2 fat set images, and the periphery of the lesion shows two lines: inner hyperintense line, that is a granulation tissue, and outer hypointense line, that is the adjacent sclerotic bone. So here we see that at the periphery two lines, the hyperintense and hypointense line. Inner is hyperintense and outer is hypointense line. This is known as a double line sign, which is pathognomonic of the bone infarct. And the peripheral low intensity line is always continuous, whereas the inner line can be discontinuous. So points to remember here is that in enchondroma, the periphery of the lesion has a single low signal intensity sclerotic margin, and the center of the lesion is hyperintense on T2 weighted images, which is the characteristic of the chondroid matrix with tiny low signal foci. And the bone infarct has a center of the lesion has a marrow signal intensity similar to the normal marrow, and the periphery of the lesion has two line, that is the double line sign: inner bright hyperintense line and outer low signal intensity line. Inner is the granulation tissue, outer is the sclerotic bone tissue. This is the case of a sickle cell anemia patient which presented with the multiple bone infarct and the AVN, that is the bone infarct in the epiphysis, are known as the AVN. And so thank you for watching this video. I hope this will be helpful. Thank you.